Okay, good afternoon and good morning. Welcome to the next in our series of Lunch and Learn advocacy sessions. Um, we will be getting started in just 1 second. Okay, looks like everybody who was in the waiting room has joined, and so we're going to just jump right in. My name is Kathleen Havey. I'm the Senior Director for Policy here at NHSA, and I'm joined by my colleague Katie Dufford-Melendez, who is the Senior Manager for State Affairs. And we are going to be talking to you today about federal to local funding, why it matters. We're going to also be digging into an alternative to federal to local funding, which we are not fans of, which is called block granting. We're going to explain a little bit about that construct, why Head Start is not a block grant, and why we want to make sure that we keep it that way. And then Katie's going to close us out by talking about local flexibility, some examples, and then also ask for your assistance in coming up with additional examples. So without further ado, let's go ahead and get started. Why it matters. Let's just go. Okay. So as you know, and as we're really paying attention to this week, right, with the potential government shutdown later in the week, et cetera, Head Start is funded from the federal government directly to localities, directly to all of you as Head Start grantees. We don't take a stop at the state level. Um, and so it is considered direct funding. Why was Head Start created this way back in the 1960s? Well, there were a few reasons. First of all, this structure really was able to, right from the get-go, enable maximum participation through direct community involvement. Local community organizations had to come together to apply for those grants way back in the 1960s. And it was a way of really deeply reaching the communities that most needed Head Start services. But number two, I would be remiss if I didn't also talk about the political dynamic that was the situation in the 1960s, with school desegregation being a difficult, challenging political issue in many parts of the country. And President Johnson at the time wanted to focus more on communities with greatest need and less on the power structures that existed in state governments at the time, which were not making it easy for children to have full access to an education as they're entitled to. So, in a nutshell, Head Start combines uniform, high quality national standards across the board with local flexibility and adaptability. Next slide. So, the alternative to this local, federal to local funding is a block grant situation. Now, late last year, we surveyed all of you, and thank you if you took the time to respond to our survey as part of our policy agenda survey. And one of the questions we asked is, tell us what your opinion is on block granting. And a strong number, a majority, in fact, strongly disagree with block granting. But what it also showed is that a fair number of folks in the Head Start community didn't really understand why I would be opposed to something like this. Or maybe I just don't even understand the point of this question. And so, one of the key things we want you to take away from today's session is the fact that block granting would end Head Start as we know it. And that is not an exaggeration. You see on the left here, this quote from then Congressman Jim Banks, who's now a US Senator. Um, and he is one of the proponents in the Congress of block granting Head Start, and you can see his attitude right here. If we refuse to reform Head Start, we're really giving up on its original goal. Congress owes it to low-income children to fix Head Start. Our bill would give states, local officials, and parents greater control over Head Start. So let's talk about how we respond to that. Next. A little bit more about what is a block grant. You can see on the left-hand side the federal funding. It goes, in many cases, it goes to states and or tribes, and then to counties and communities. Whereas for Head Start, it just goes directly to Head Start in counties and communities. But block grants, by and large, are fixed pots of money that the federal government gives to states to provide benefits or services. They're designed to give states broad flexibility over how to implement the program. Funds are usually fixed over time. So I'm going to go through a couple of examples to kind of show you what that means in real life. We're going to start with TANF, Temporary Assistance for Needy Families, which sometimes is called welfare. It's cash assistance. It was created in 1996. It has been flat funded since 1996. So that should tell you something right from the start. The original intent of TANF is temporary cash assistance for low-income families. What does TANF look like now? Well, this is a block grant, remember? So it goes to states, and here's the original intent. However, state spending on non-cash assistance is now more than state spending on cash assistance by a wide margin. So remember, the original intent was temporary cash assistance, and now states spend more on other things than they do on cash assistance. Also, the number of children who are served has dramatically shrunk. In 1996, cash assistance welfare, it used to be called AFDC, covered 59% of poor children. In 2022, TANF covers 18%. I have a quote here from Brett Favre, the retired NFL quarterback. Our laws don't sufficiently protect against TANF spending that is unrelated to helping people out of poverty. Now, why in the world am I mentioning Brett Favre as a quote? Well, it's because in the state of Mississippi, they felt that a fair use of their TANF dollars should be a couple $1 million to Brett Favre to give a motivational speech or two. I can't remember the details. And that was uncovered. It was controversial, as you can imagine, because it is about as far removed from this notion of temporary cash assistance as you can possibly get. So he was called before Congress, he was contrite and the whole thing. But the point being that that we've come a long ways from what Congress originally intended back in 1996. I think,
Kathleen, there is a question in the chat about what is non-cash assistance?
yes, thank you, Katie. Non-cash assistance can be supportive things like childcare. So it's anything where the family is not getting a cash benefit. So it could be job training. And so these things are worthy, just to be very clear. But the original intent is to provide that cash support that could be used to pay your rent, pay food, pay for your child's school supplies, what have you. And that has moved in a direction of other things. States have also used non-cash assistance. They've also used this money for things like scholarships, to send kids to private schools or other things that get quite far removed from the original intent of the program. Good question. Okay, so that's TANF. We've established that it looks a whole heck of a lot different now than it did back in 1996. So let's take us to the right now moment. There is talk right now about Medicaid being block granted. And block granting Medicaid, let's remember, it equals capping spending. So you see this chart on the right, where you have level funding going across for block grants, as opposed to funding that adjusts up and down depending on moments of need, such as recessions, population growth, or in the case of Medicaid, increased costs of medical care. All of those impact how much Medicaid dollars are available, and it does go up or down. Basically, it goes up because we all know that the rising costs of healthcare really only go in one direction. And so, what would that mean? That would mean states have to cut who is covered and what services are covered. Next slide. And these slides will be shared. So what would block granting mean for Head Start? Here are some likely scenarios. Policy councils would be eliminated. States would not be required to do many of the things that are required in the program performance standards and the Head Start Act. Because that's the point of a block grant, is to just hand over the money with very few restrictions, and then states would, do with it as they would. Parent and family engagement would be weakened. Comprehensive services would definitely be weakened, especially in times of tight state budgets. You would likely see in some states it to be merged in with state pre-K. And if that happened, you would also like to see some Head Start dollars offsetting the amount of administrative costs that states spend to run their pre-K system. You'd also see tight state budgets or other priorities inevitably forcing a dilution of the mission of Head Start, even in states where they are well-intentioned. Budget pressures happen, recessions happen, and states make difficult choices that would likely compromise the program. One example that I just point out, the state of Pennsylvania was an early Head Start grantee, and they struggled with all of these requirements in the Head Start Act. They ended up giving up the grant because they found it to be too hard to meet the standards that are required for a Head Start or an early Head Start program. Um, uh, Questions, I'm just looking right here. What do we mean by comprehensive services? All of the screenings that are done, the health and nutrition, dental support, immunizations, and then parent support, like parent engagement, supporting parents in their search for a job, or goal setting, all of those types of things. Why wouldn't states keep the performance standards? They would likely want to simplify them, maybe merge them into what they already have for their state pre-K programs. And even if they started right from the beginning, mirroring what Head Start standards look like, they would adapt them to be their own, and then you'd have wide variability, especially over the years, with respect to what children are being served, where those grants are located. Are we really and truly meeting the highest need children? Those decisions would be made by states. So here are a few block grant arguments, and I just wanted to kind of talk about them a little bit. I was, just by way of background, I worked on Capitol Hill when the welfare law passed. So I was in the room, and I was absolutely there when governors promised up and down, left and right, that they would, of course, maintain the core commitments in the TANF bill to providing cash assistance. And seeing what has happened a generation later is really instructive. So here's one argument. My state already has a strong pre-K program, and our governor is a supporter of Head Start. Why wouldn't I want my state to control Head Start funding? Well, your governor is not going to be governor forever. That no matter how great your governor is, there's always another one coming down the road. You don't know who he or she might be and what their priorities might be. They might not be opposed to Head Start, but they might not be fully committed to really the core mission of Head Start. Um, Likewise, pre-K, as we all know, is not one and the same with Head Start. And even in states that have strong pre-K programs, they still are can be quite different and certainly not uniform across the country with respect to high standards. Here's another. It's been really hard working with OHS in recent years. I think we might prefer to answer to our state instead. And, for this, I would just say, as with all relationships, they all ebb and flow, right? They have their periods of strain and challenge. And then, you get it back together, you improve things, you work on your communication, et cetera, et cetera. Certainly, things have been challenging with OHS in the last couple of years, but that doesn't mean that the grass is greener on the other side of this fence just by going to states instead. Last one, the Child Care and Development Block Grant has increased rapidly in recent years. How do we know that won't happen to a Head Start Block Grant too? Yes, child care funding from the federal level has increased rapidly, and that is fantastic for children across the country and their families who have to go to work. However, that's just been in the last few years. CCDBG has been flat funded for decades before the pandemic really highlighted the importance of childcare in supporting working parents. And so they've been having their moment. And like I said, that's excellent. But let's just look at the long-term trend lines and say that childcare funding has not actually been on the rise like we think it has. Okay, next slide. Okay, so I'm just about done and I'll be turning it over to Katie in just a second, but I want to leave you with these key messages in response to block granting. Number one, block grants would end Head Start as we know it. Number two, local flexibility, not one size fits all, is a core part of Head Start. Here is where you can provide an example from your program or your state. And Katie's going to be talking about this in just a moment because Head Start is not a rigid program. There is a lot of adaptability that local programs are able to use. Don't change what works. Research proves it. Don't see the other session for more. This is a slide I took from somewhere else, but we do have a lot of research data on our website that demonstrates that Head Start works. And then last, Head Start's mission to serve young children and families from the highest needs backgrounds. That was true in 1965, and it remains true today. Katie, I'll turn it over to you.
Thanks, Kathleen. I had to make sure I unmuted. Before I do anything, because I will forget, I'm going to put my email in the chat and my full name, because now is when we need your help. As Kathleen said, this is really important for us to get out how our Head Start programs adapt to the needs in local communities. And we are looking for examples of how we exemplify local flexibility. And if Courtney, if you could move the slide forward, that'd be great. Thank you so much. And so we're pulling together this compendium that's going to highlight different programs from around the country. and how our Head Start is such a unique program and how it differs from community to community. And that could be a program that is focused on fathers and making sure we include fathers. There's programs out there that work with incarcerated parents and making sure that those early bonds are still connected. Faith and community-based programs are super important. I just heard of a program that works with the LDS community in Utah, where they're home visiting materials adapt and work with that particular faith-based community. Unique partnerships. I saw another one that was partnering with a museum, a children's museum. So that's where they have their Head Start programs. AIAN, American Native programs, and then farm working and agricultural programs. So we're looking for these different programs. We would love to have yours highlighted, especially there was, and Courtney, if you can forward as one more, please. Here's just kind of a wide range. I was just trying to give a few examples. There's a program in Alaska that the subsistence fish camps, and they make sure that families and children have these materials that move with them. So that way families can continue learning over the summer and our children can continue. The Our House program in Georgia is a shelter specifically for those experiencing homelessness, and they make sure that families have access to healthcare, early childhood education, housing, and employment. And then this other, it was a different program in Utah I thought was really interesting. They're a small rural program, and while they were trying to do their change in scope to extend their day and did kind of a community needs, they realized that their community was one of the poorest as far as health outcomes. So they wrote in their change in scope to make sure that they can increase their food services and maintain the cooks in-house so that everything coming into their program is fresh and healthy. Their classrooms are labeled fresh and healthy. Everything is homemade, not processed, pre-made, or frozen, so that they can hopefully have a stronger impact on the health outcomes for their families. So I'm seeing some things coming into the chat. We're super excited, and thank you very much for adding some of these in here. My email is right there, and I'm going to put it in there one more time while Kathleen closes us out.
Thank you, Katie. And with apologies to my colleague, there was a minor typo in your email address. I forgot the hyphen. So, but it is in the chat. And also I also put a couple comments saying we have a few minutes to take questions, or if any of you want to share something about your program that that makes you unique, please unmute yourselves, and we do have a few minutes. Meantime, there is, let's see, couldn't providing local flexibility also be an argument in favor of block grants? So it depends on what your state wants to do. If your state wants to only focus on 3 and 4-year-olds, you're out of luck. And so it does not mean local flexibility. It means state is making the decisions for you, not you yourselves. And so that all depends. And they might say, you know what, we have a real priority in, like I said, focusing on school readiness. We're not going to do babies and toddlers. Or the opposite, you know. And so one of the criticisms about Head Start as a big $12 billion a year program is that it's rigid, it's one size fits all. The federal government is telling you in your community what to do. And we're trying to say here, no, that's not true. You know, that's really not true. There are high national standards and expectations. But if you want to be running half-day programs because that's what your community wants, you can do that. If you want, the school calendar to adapt to local traditions, and cultural celebrations and all of that, absolutely, that's all on you. So, I'm trying to see, Katie, are there any other questions in here? And if, um, If anybody wants to raise their
There's
hand.
one here. It says, with continuing resolution expiring on Friday, will block granting Head Start be decided by then, along with the other federal funding uncertainties?
Thank you, Erin, for that question. This is completely disconnected from what's going on this week with the federal budget. I want to emphasize that fact. Any threats with respect to block granting are going to come further down the road in other contexts, but that's not something that we're seeing this week. This just happens to be the timing of when this session is and everything else going on.
And then Jeanette Rodriguez says that the quality is just different. For example, our local pre-K has professional development along with sixth grade teachers, facility priorities, et cetera, whereas we can tailor PD to our early childhood professionals.
That's a great example. A great example. Yeah. And I see another comment about a partnership with WIC in Michigan. And that looks like a great example. And Jennifer, expect to hear from Katie because we are literally trying to make sure we have one or two examples from every single state. Some of them are pretty cool. But it's not, the purpose is not to find the biggest outlier, like there's a program in the base of the Grand Canyon, for example. But it's rather to just kind of show that this is where what the needs are, where the needs are, and this is how Head Start meets them. So yes, Sylvia, if any block granting threat comes up, you can be assured that this would be DEFCON 5 or what have you, that you would be hearing from us and we would be getting very loud very quickly. We just wanted to really educate the Head Start field just more broadly. And so we did a session at our winter conference on this topic and also wanted to have this conversation so folks understand what we're talking about. Because block grants in and of themselves are not terrible, but how it would play out for Head Start would be really the end of Head Start as we know it. And so, yeah.
There is something up here too. We're a program that has 2 early Head Start seats for every 1 pre-K seat. Can you speak of block granted that prenatal mothers and infant toddlers are at risk for not getting services within the block grant system? We've been told that school would not want to do babies and could be dropped from services.
Yeah, that happens. Lots of school districts are not interested in serving babies. And so and then prenatal services, it all would depend on what your state legislature and your governor decided to prioritize. So if they said, you know what, we're just really only going to focus on threes and fours, um, or we don't want to do any prenatal, despite what this community has decided is a priority, then that. That's how block granting works.
And I know we're past time, but I think this is a good question about where Head Start sits as well. It says the block grants would be in line with them dismantling the Department of Education and putting everything back on the states.
Yeah. Yeah. Now let's also not forget, important to note that Head Start is funded through HHS, not through the Department of Education. So all of this talk about dismantling the Department of Education, while it is absolutely terrible, and especially for children with disabilities, and low income children as well. Anyway, I won't get started on that, but Head Start is funded through HHS, not the Department of Education.
Okay.
Yeah, in Colorado, 0 to 3 was typically home visit focus, while pre-K 3 to 5 are in the public schools. Yeah, that's a common structure.
And I know we're past time, but another person says my state has no pre-K program and Head Start's the only government funded preschool. Block grant funding would significantly impact this program.
Yeah. Yeah, there are 6 states that have no state pre-K, and they tend to be small rural states. So Courtney, our producer, is saying that everyone will receive a follow-up email with access to the slides and the recording later this week. If you want to share Katie and me with your family and friends around the dinner table, feel free to do so. But thank you everybody for joining us this afternoon / this morning. We appreciate all of you and the work you do every day. And it was a pleasure being in community with you for a short while of your day. Thank you.
Thank you for the good work.